From the NHS front line to the picket line. On a miserable Monday morning, outside hospitals across the country, they made noise. And history too. For the first time ever, midwives joined their colleagues on strike. It's overpay and not something they took lightly. But after 21 years in the job, Antoinette works 2 extra shifts a week to make ends meet.
Without the pay, we can't live. Without an increase to our pay and our working conditions, you're going to have a lot of midwives burning themselves up, doing up to 6, 8 extra shifts every month just to get through.
The dispute comes after the government's own independent pay review body recommended a 1% rise to all NHS staff. That's just over 1 million people. But ministers decided not to apply it to workers who can still earn an increase by moving up through their job band. Unions say that means around 600,000 staff will miss out. And so to this. In some hospitals, soldiers stepped in to help ambulance staff during the 4-hour walkout. But the government is standing firm and says there just isn't the money for everyone.
We have very clear analysis that says that if we did that, hospitals next year would lay off around 4,000 nurses and around 10,000 nurses the year after that. And that would be very, very dangerous for patients.
That's no comfort for strikers.
Many workers in the health service, for example, are £5,000 a year worse off in real terms than they were when this government took power. People still need to pay their bills, they've got children to feed and clothe.
With an NHS funding black hole of £30 billion, workers here know the NHS needs to tighten its belt. But they say they can't be squeezed any further. Tessa Chapman, 5 News.